Good day everyone, welcome back to our YouTube channel. I still remain Adegbite Olushola. Please, if you are yet to subscribe to our channel, please do so you can get exciting videos. And also you can click on the notification button so that you can get notified whenever we upload videos. So please, if you are yet to subscribe, do so by subscribing. Press the subscribe button, like our videos, share and comment on them. So today I bring to us a topic that is a common disease, a common virus in our environment, known as HIV, human immunodeficiency virus. It is a very common virus in our environment, and there are a lot of people living with this virus. Yes, having an HIV virus is not the end of life. There are ways in which you can treat HIV virus and you prevent them as well. There are drugs, there are antiviral drugs you can make use of to prevent, for those that have been exposed to this virus. Yes. So today I want to talk about this virus, and also if they are not treated, what will happen, and also the opportunistic infections that destroys the cell, as well as I will talk about the way in which this virus destroys our immune system. Yes, HIV virus, which is known as human immunodeficiency virus, is an infection that attacks the body's immune system. The body's immune system is the body defense mechanism, is the body defense cells. They are these cells that defend the body. They defend infections from entering the body. So immediately the HIV virus sets in the human's body, they target the body defense cells. The cells are known as CD4 cells, which means cluster of differential 4. So these cells helps in coordinating the immune system. As we all know that the immune system is associated with the white blood cells. The white blood cells helps to defend, prevent and defend the body. So once this virus enters into the body, the target straight the cells that helps to coordinate the immune system, which is the CD4 cells. So an AIDS is acquired immunodeficiency syndrome, which you all know as is popularly known as AIDS. This is the advanced stage of HIV. Yes, if HIV is not well treated, it advances into AIDS, and AIDS is more dangerous. So you need to get yourself checked regularly, especially those that are exposed to body fluids, exposed to unprotected sexual intercourse, exposed to sweats, fluids or vaginal semen of vaginal fluids from an infected person. So like I said earlier, the HIV targets the white blood cells. They weaken the immune systems immediately, and this will make it easier for people that are living with HIV to get sick and to get opportunistic infections so easily. Opportunistic infections are those infections, they are common conditions that we all know that enters the body whenever they see any little opportunity. They will invade into the body of a person and starts manifesting in such person's body. So a person living with HIV/AIDS is prone to opportunistic infection. Why? Because the immune system is being weakened. So HIV is being spread from fluid of an infected person, including blood of an infected person, the breast milk of an infected person, semen of an infected person, and vaginal fluids of an infected person. So if you have an infected person closer to you, you need to be more careful. Get yourself well checked. Go for regular checkup to be sure you are not exposed to HIV virus. So I want you to note that HIV virus is not spread through kiss. It's not spread through hugs, and it's not spread through sharing of food. It's not spread, but it can be spread through body fluids. So we have to be careful when dealing with people living with HIV/AIDS. It can as well spread from mother to child, mother to baby. So there are ways in which we can prevent HIV from being transferred to the newborn baby. There are ways it can be done, yes. And there are ways in which you can live, as a husband, you can live with an infected wife, with an infected partner. If your partner has HIV/AIDS, you can live with them. There are ways in which we can, there are drugs in which will be prescribed to you and that of the woman herself or your partner. HIV can be treated and prevented with antiviral therapy drugs. There are antiviral drugs, antiviral therapies. But when HIV is not being treated, it leads to AIDS. Like I said earlier, AIDS, acquired immunodeficiency syndrome, is the advanced stage of HIV. So before I talk about the signs and symptoms, I will explain thoroughly how HIV penetrates and weaken the immune system. Like I said earlier, yes, you are prone to opportunistic infection if you have HIV that is not well treated. Like I said, HIV, those virus enters into the body. Once they enter into the body, they attack the immune system, that is the body defense cells, which is known as the CD4, that is cluster of differential 4. These cells help to coordinate the immune system. So once they attack these cells, they destroy the cells. They destroy these cells. So once they destroy those cells are no longer, they will not be able to defend the body from infections or other microorganisms. So, but non-infected CD4 cells, they no longer work properly. Yes, the CD4 cells, the infected CD4 cells, they get destroyed, but the non-infected ones, they will no longer work properly, and thereby the immune systems slowly get damaged, therefore making a person with HIV prone to opportunistic infection. So I'll be talking about the signs and symptoms of HIV/AIDS. The signs and symptoms of HIV/AIDS are the early stage. For the early stage, we have fever, headache, rash, we have sore throat, and then it begins to progress. As it begins to progress, like I said, that it will attack the immune system. They will begin to weaken the immune system, and it can cause signs and symptoms like swollen lymph nodes, weight loss, fever, diarrhea. There will also be cough, then also sweating profusely. So now it has another stage, and without treatment, people with HIV infection can also develop severe illnesses such as tuberculosis, cancers, severe bacterial infections, and so on like that. So like I said that HIV can be transmitted. I've already talked about the transmission, yes. So what are the risk factors? That is, if you fall under this category, you tend to have HIV. You tend to contact HIV from an infected person. So like one of the things that put people at risk is behaviors and conditions. There are some behaviors that put people at risk, yes. For example, having an unprotected sex, having without using condom. If you do not use condom when having sex, you are prone to have infections. They have this infection, which is HIV/AIDS. Another one is sharing of contaminated needles, sharing of contaminated blades, syringe, and other other instruments or things that can easily puncture your skin or your skin. So if the needle you are using is infected with this virus, and you make use of it, you tend to have such this virus, like I said. Also, blood transfusion can lead to HIV/AIDS. So if the blood is not well screened like it should, you are prone to have this virus, HIV virus. And also tissue transplant also can lead to what? Tissue transplant can lead to HIV virus. And also unsafe medical procedures, that is, there is this we call nosocomial infection, that is infection that can be transferred in the hospital setting, clinic, or anywhere. So you can contact it from hospitals as well when you are not practicing safe self-hygiene in the hospital you are. So there are different ways in which HIV can be diagnosed through different tests and so on. And if you know that you've had an unprotected sex with someone that is infected, quickly go to the clinic for proper drugs. There are pre-exposure drugs, there are post-exposure drugs, and there are drugs for those that are infected as well. Ways in which we can prevent HIV virus: using to reduce HIV virus in your environment. So when you use condom, we have male and female condom to for sex. If you want to have sex, you protect yourself, protect your partner by making use of condom. And also you have to go for regular checkups when you know you have done something that might, cause you to have this virus. Then another way is avoiding harmful needles, avoiding blades around. You don't just use any blade you see around. You make use of your own things. Don't share things. Don't share needles, sharp objects. Don't share it. Don't use the blade or needle someone else have used before. Another one is assume everybody in your area, in your environment, are infected. Even if you are going out, assume the person walking beside you is infected. With that, you can be conscious of yourself, and you will be able to prevent this virus. So there are, like I said, there are antiviral drugs that can be used if you are exposed to this condition, this virus. You can easily go to the nearest hospital to check, because there is life cycle for this virus. There is life cycle. You can get infected now, and you might not know that you are infected. It will not show symptoms until it gets to the stage it needs to start showing symptoms. So if you are among this set of people that you feel like, oh, you are at risk of this infection, this virus, HIV virus, go check yourself, then get drugs, talk to your doctor so that they can give you the prescribed drugs needed. So I hope today I've been able to pass a very vital information. Please practice safe sex, because I think this is one of the major reasons a lot of people get infected. But that's not the only reason. Like I said, it's just the major. There are other ways in which it can be transferred, like using someone's sharp objects, sharing things. So like I said, don't misquote me. HIV cannot be transferred through hugs, through kiss, or through sharing of food. So you are free to share food with your neighbor. You are free to share food with them, but avoid using sharp objects. Avoid sharing of belongings. Thank you.